Hi, my name is Nathan, and I'm going to be demonstrating injections. The first of the injections is intradermal. It's a 26 to 27 gauge needle. The length for it is not threes, that's so cute, is 1/4 to 1/2 of an inch. The max you can give is 0.1 milliliters, and you give it at a 5 to 15 degree angle. You're either going to give it in the inner forearm or the upper back, and you're going to give it bevel up as well. Make sure it's bevel up. And that's it for intradermal. Then sub-Q, it's going to be a 25 to 27 gauge needle. You are going to give a max of 1 mil with that, and the length of the needle for that is 3/8 to 5/8 inches. If you can pinch 2 inches of skin, you're going to give it a 90 degree angle, but if you can only pinch 1 inch, you're going to give it at a 45 degree angle. And the landmarks for that are the abdomen, the upper posterior thigh, the upper outer arm, and subscapular. And I believe that's it for that. Next is the intramuscular, and for all intramuscular, they are the length. For the deltoid intramuscular, the length is 1 to 1.5 inches. The max you can give is 1 mil. The needle gauge is 21 to 23, and you're going to go 1 to 2 inches below the acromion process for that, and you do not aspirate for that, and you give that at a 90 degree angle. For the ventral gluteal, you are going to give that at a 90 degree angle as well. It's with a 21 to 23 gauge needle. The max you can give is 3 mils, and the needle length is going to be 1.5 to 2 on that. And the way you find the ventral gluteal is you put your hand on the greater trochanter with your thumb facing the front, and you have you have it pointing at the anterior superior iliac spine and the iliac crest, and you give it right inside of that V. And then the last of the injections is the vastus lateralis, and for that you reach across and you put your one hand below the greater trochanter and your other hand above the knee, and you give it kind of in that window that you have right there, and that you're going to also give with a 21 to 23 gauge needle, and the length for that is going to be 1.5 to 2 inches. The maximum you're going to give is 3 milliliters, and the angle is going to be 90 degrees. And now I will demonstrate all the injections. I'll act like this thing and this butt are my patient, and I will come in, and first I'll wash my hands, and I'll come in and I'll say, "Hi, my name is Nathan. I'm going to be your nurse for today. The doctor ordered a few injections for you. Could you tell me your name?" And I would check their name and their birthday on their wristband, and I would ask them for both their name and their birthday. And then I would put gloves on. And then if they asked, I would explain what drugs I was giving them and what the purposes are for all of those. The first one I'll demonstrate is intradermal. So you would take the needle and you would clean the area with an alcohol swab, and the max is 0.1 mil, so that's what we'll say we'll give it. And with that, you make a C with your hand and point it and bevel up at 5 to 15 degrees, push it in, take it out, straight to sharps. For sub-Q, you would clean the area with an alcohol swab. The max you can give is 1 mil for that, and you give it I can only pinch 1 inch, so I'll go at a 45-degree angle in, start sharps. And then, like I was saying, for intramuscular, for the deltoid, you're going to go to the acromion process and go 1 to 2 inches below. Give it right there. We'll act like this is our deltoid. And so for that, you go in at a 90-degree angle, and you don't aspirate, and then you just inject it in, straight out, into sharps. And for ventral gluteum, put your hand on the greater trochanter, point it toward the anterior superior iliac spine and the iliac crest. And for this, you are going to aspirate. So in, aspirate. Good, no blood. Right out. Into sharps. And then for vastus lateralis, going to go below the greater trochanter, above the knee. There's my window. So in, aspirate, check out, and into sharps. And for both of those, I would clean the area with an alcohol swab as well. And that's it.